Good afternoon, everyone. My name is Alexa Eggleston, and I am the Substance Abuse Program Director for the Council of State Governments Justice Center. I want to thank everyone for joining the webinar today to learn more about the Bringing NIATX to Corrections project. This is an exciting new project to strengthen collaboration between corrections and treatment agencies and to improve access to treatment for people who are involved in the criminal justice system. The purpose of this webinar is to provide you with additional information to support your application to be a pilot site for this Justice Center Department of Justice initiative. Today we are joined by Danica Sarvis-Kidd from the Bureau of Justice Assistance, myself, and Kim Johnson, who is the Co-Deputy Director of the NIATX National Program Office at the Center for Health Enhancement System Studies at the University of Wisconsin-Madison. We really appreciate both Danica and Kim taking time out of their busy schedules to be with us today, and of course to all our participants. Before we hear from Ms. Johnson, who will begin the webinar by reviewing the NIATX model, I would like to turn it over to Ms. Sarvis-Kidd from BJA to welcome you all to the presentation. Danica?
Thanks, Alexa. My name is Danica Sarvis-Kidd, and I am a Policy Advisor for Substance Abuse and Mental Health at the Bureau of Justice Assistance, which is a component of the Office of Justice Programs at the U.S. Department of Justice. We've awarded the Justice Center an Encouraging Innovation Grant to partner with NIATX, formerly known as the Network for the Improvement of Addiction Treatment, to pilot their nationally acclaimed substance abuse treatment process improvement model for the first time in a Department of Corrections, jail, or parole and or probation agency. As we know, people in jail and prison have high rates of drug dependence and abuse, and few receive treatment while incarcerated or in the community. The goal of this project is to improve the treatment referral and coordination process between prisons and jails and community treatment providers. NIATX works at a system level to eliminate barriers to effective community-based substance abuse service delivery, which is an important factor in reducing criminal justice involvement. The results of this project will help corrections and treatment practitioners understand how implementation of a process improvement model in a correctional setting can lead to more efficient and effective treatment referral and engagement. The Bringing NIATX to Corrections project is the first time NIATX is being applied to corrections and will potentially have far-reaching implications for behavioral health and criminal justice systems collaboration. It's for that reason that BJA is very excited to be supportive and funding this project and this program, and look forward to all of the great work that is to come. Thanks so much.
Thank you, Danica. Now we are going to hear from Kim Johnson, the Co-Deputy Director of the National Program Office for NIATX, who is going to begin the webinar by walking us through the NIATX model to better familiarize it for those of you for whom it may be new. The second part of the webinar will review the specific goals of the project, the application, and then we will answer any questions that you have. To ask a question, please type the question into the Q&A panel on the bottom right-hand corner of your screen. Please feel free to ask questions throughout the webinar, and we will answer them at the end. We will do our very best to answer your questions. We do have several hundred people on this webinar, so please understand all the questions may not get answered, but if that occurs, please feel free to contact us after the webinar, and we can answer your questions at that point. If you do encounter any technical or audio problems during the webinar, please call WebEx Technical Support at 1-866-229-3239. We are recording the event, and it will be posted on the National Reentry Resource Center website. I believe it's posted there now, and that link is www.nationalreentryresourcecenter.org. And with that, I am going to turn it over to Kim.
Hi, everyone. Okay. So this is Kim Johnson. Sorry I have such a long title. I won't repeat it. I'm going to give you just a little bit about the NIATX model, just enough so that you can fill out your application well. And we will, once we've gone through the selection process, then we'll spend a lot more time in training and getting you to understand what this whole thing is. NIATX, as Danica said, did used to stand for the Network for the Improvement of Addiction Treatment. but we've worked with a lot more than just addiction over the past few years, and so now we kind of just go by NIATX and don't talk only about addiction. So really what we are doing is introducing systems engineering to social services and behavioral health. And the one part of the title that isn't on there is that we are in the engineering department at the University of Wisconsin. And that probably seems strange to people, but what we're really looking at is something that has been used in industry for almost 70 years, and looking at how our systems work and how we do our work. And so I have a couple quotes to start off with. I think these really kind of frame what I'm trying to say. Paul Batalden is one of the founders of the Institute for Health Improvement. And what he said was every system is perfectly designed to achieve exactly the results it gets. And so if you have long wait times, if you have difficult transitions, what Dr. Batalden would say is that that's what your system is designed to produce. And so what we're going to try and do is create systems that are designed to produce rapid handoffs, good coordination of services, and to solve those kinds of systems problems that you may be encountering. Dr. W. Edward Deming is actually the person who created systems engineering or industrial engineering. And the quote from him is that 85% of problems that organizations have in serving customers, and you can define customers in a lot of different ways. You could say offenders, you could say referrers, you could say partners. But he uses the word customers are caused by their processes. So the way I like to think about this is I've been a manager for a long time, and I probably spend 85% of my time dealing with personnel as opposed to the processes. And Dr. Deming would say that's completely backwards, and that we should be looking at how the work is done and what it is we're doing, and not who's doing the work and how well they're performing. And so that's really what we'll be doing, is looking at processes, trying to change processes and not people. Now, this is sort of a discouraging slide to have at the beginning, but 70% of organizational change efforts fail or are not still in effect 12 months after implementation. And the reason for that is because of the way people do the implementation process. And so what we'll do in this project is really help you focus on the important things that will make it successful. Dr. Eggleston, who is the founder of NIATX and the director of the center that we work in, did a meta-analysis of what makes change effective. And in that study, he identified these 5 key principles. And that analysis was across industries, so it included healthcare, but it included other kinds of businesses. So these 5 key principles are really what are the evidence-based predictors of change. And when we do the training after the application process, we'll get into each of these in a lot more detail than I'm going to do today. But understanding and involving the customer, and again, we can talk about what that means for you all, who your customer is that you're talking about, because it may be an offender, but it may not be. That may not be who you're thinking of as your customer in this process. I'm focusing on key problems. So one of the things we like to say is what keeps the CEO or the executive director, the facility manager up at night. And if you solve those problems for that person, then probably that's a change that's going to stick. Selecting the right change agent, and because I think that's really important in the beginning of the process, we'll spend a little bit of time in a few minutes on that. Getting ideas from outside the organization and outside your field or industry. So looking outside of yourself to see what other people have done this kind of thing really well, and how can we imitate what they've done. So we're going to look at how you can copy what others have done in a way that works for your own organization. And then the last one is probably the one that's most foreign to all of us in the fields that we work in, whether it's criminal justice or treatment or social service or government, is rapid cycle testing. So the whole Plan, Do, Study, Act, and doing that that doing pilot tests in a really rapid cycle kind of a way is one of the things that we're going to work a lot on and trying to see what works before we actually implement it. So just a little bit about what we're going to do, what you'll get out of participating in this, or what I hope you will get out of participating in this project is, first of all, developing a deeper understanding of what process issues your system has through process mapping and wherever possible walkthroughs. So I want to talk about that a little bit because I think some of the systems issues that you are going to identify, it's not possible to do a walkthrough for, but for anything that you can use the walkthrough, I'm going to encourage that. And actually, if you can use it before your application and write about it for the application, I think that's going to really strengthen your application. So I'll just talk about a walkthrough for a second. You can get more information about walkthroughs from our website, www.niatx.net, and there are instructions and even a form to fill out for a walkthrough. But doing a walkthrough is putting yourself in the customer or the client or the offender's shoes and going through whatever that process is as though you were that person. So just an example that might make sense to you all, if you're thinking about reentry and someone is going from being incarcerated to going back to the community, and you're trying to get services for them, or you've given them some referrals and they're trying to get services. Going through that process yourself as though you were that offender going back into the community, trying to access services, and to see what that's like, because if you can do that personally, you get a much stronger sense of what those systems issues are. And one thing I always say about doing that is it's not mystery shopping. We're not trying to catch people doing their jobs badly. So if you're a senior manager and you're doing a walkthrough of a process in your organization, people are going to know who you are, and that's perfectly fine because you actually want them on their best behavior. You want them to do their job the way it's supposed to be done. And I guarantee that it will make you ask questions like, why do we do it that way? And that's what you want to figure out. You're not trying to figure out when people make mistakes. You're trying to figure out when they do their job well, why doesn't it still work? And so if you have questions at the end about walkthrough in particular, I can try to answer those. Again, go to the website. But as much as we can use that tool, in a lot of my projects, I feel like if people get nothing else out of this, if they can understand and do walkthroughs and use that as a tool for identifying ways to improve their organization, it's a gain already. So I won't dwell any more on that, but if you have questions, I'll be happy to answer later. Another thing that we will do during this project is identify appropriate, simple ways of collecting data to know when something that you've done, whether it's better or worse. So we'll be doing rapid cycle testing, and we'll be measuring the outcomes of what we've done in very simple ways, either using information you already have, data you already collect, or using back-of-the-envelope sort of hand calculations. So it won't be a complicated process of how to measure things, but we'll talk about easier ways to measure whether something's an improvement. We're going to teach some tools that are decision-making tools that help you engage your team. One of them is called the nominal group process, so that you can engage your team in problem solving. And so where we want to get is, for some organizations, people might grouse about issues but not come up with ideas about how to solve those problems. And so we really want the whole team and eventually the whole organization, whatever that means for you, to start thinking about how you solve problems and to always approach an issue or concern with a problem-solving kind of approach. And so so we'll spend some time on that, on easy ways to do that. And we will learn and practice multiple rapid plan, do, study, act cycles. And so you may have heard that language before. It's relatively common in a variety of industries. And we're going to do rapid cycles, so 2, maybe 3-week pilot tests. That's really what this is when the do is a pilot test. And learn how to make change in a way that is incremental but rapid, and ultimately can make profound changes to your system through these rapid cycle, pilot testing, measuring, and then deciding what makes sense to implement and what makes sense not to implement. We're also going to use a collaborative learning process, which is very, for adults, talking about what they're doing, sharing with each other is probably more important than any kind of didactic teaching we can do. And so we'll have this collaborative learning process where all the people that are participating get together by phone at least once a month. If you want more, we can do more. Once a month seems to be what people are comfortable with, to talk about what's working for them, what's not working for them, get advice from each other, and periodically, if the whole group has specific issues, we can bring an expert in as well. So some of our jargon, because I think some of this is in the application, it'll be important to understand and be able to use. Executive sponsor is the senior person in your organization. If you can have the most senior person who basically says, we want to do this, and I'm going to select a change leader and empower that change leader to carry out this whole project. And so it's critical that you have a senior person that is very interested in participating, because they're going to be the one that says yay or nay as you go through these rapid cycle changes, and there needs to be someone that's really on board with doing this process. The change leader is the person that does most of the work, and I'll get into what makes a good change leader in just a minute. The change project is the thing that you're doing, so we'll select one aim to start with, and you may do lots of little rapid cycle changes towards that one aim. And so the change project is sort of the whole big thing. I have this goal, this aim that I'm trying to reach, and this over the course of a year. Maybe it won't take that long. Maybe it will take you just 6 months, and you can pick a second project, or 3 months, and you can pick a second and third project to work on. But it's the whole process that you're trying to change. And the change team is the group that's working on the change project. So the executive sponsor role, they're the senior leader, the most senior person that you can get that can make decisions. They need to see this as a priority. It's really up to that person to be able to identify the problem and articulate a vision where it is you want to go. I would recommend that if you do a walkthrough, that it's the executive sponsor that does that. It's not always possible, but it's really good when you're in that role to be able to do that. How I became involved with NIATX was through my work in state government. I was the executive sponsor for a grant like you're applying to now, and did walkthroughs myself. And I can tell you, whether I was walking through my own internal sort of state processes, or whether I was walking through a treatment agency as though I were a client, it was very enlightening. So it's really good to have the executive sponsor engaged in that problem identification through that means. The executive sponsor demonstrates commitment to the process, and that does mean time and resources, and we can talk a little bit about how much time and how much money, generally speaking, is not necessary. And I try to tell people pick change projects that don't cost anything. But time is a resource and an important one, and people will need to be able to devote a little bit of time to this. The executive sponsor also empowers the change leader. So in choosing a change leader, you need to give them enough power to make things happen. So they may need to come to you to say, we did this pilot test and it worked really well and we want to make this how the organization works now, but they need to have the power to say, okay, we're going to pilot test this thing and we're going to do it. It's just part of the organization and with these people. And so you need to pick somebody that has the ability to do that, the authority to do that within the organization. It's also important to have a person who can instill optimism in the group, can think big picture, and that's just a good project manager that can make sure that things happen and that people follow through. It's a good idea to have a sense of humor because some things are going to go really bad. That's kind of the point in a lot of ways. You want to be able to pilot test things, and some things will go amazingly well, and you'll be astounded at the results for a small change, and then other things are just going to be complete failures, and you have to be able to accept that. So I always try to get people to think about somebody that is a natural leader as well as having authority in the organization. They don't necessarily always go together, but it's good to have both those traits. What the change leader does is they're really the catalyst to developing ideas. So they have a team. The team's going to develop ideas, but the change leader leads that process. They're communicating. They're communicating to the executive sponsor. They're communicating to the team. They're communicating to anyone outside the team that needs to know about what they're doing. So that communicating, whether it's listening or whether it's passing on information, is a huge part of this role. It's their job to minimize resistance to change. You're always going to have resistance to change. That's just human nature, and so they have to manage that. And it really is, again, communicating with the executive sponsor is really important. In choosing change team members, it's good to pick people well, first of all, I wouldn't have 3 to 5 is a good sized change team, so you want a pretty small group. You really don't want more than 7. Even if it's across multiple organizations, if you can keep it under 7, it will function much better. Groups much bigger than that don't work very well. And so who you want to think about putting on your team is people that are impacted by the problem, people who are maybe invested in the outcome of what your change project is, people who have insight into the process. So actually, it's very good to have clients, former offenders, people that have been through the process on your team, to have at least one person like that because they keep you honest. And again, other people on your team who will be honest and might have different ideas. And we have a lot of debate here about, do you put the naysayers on a change team or not, because they can totally kill the process. If you have a good change leader who is good at managing negativity, then I would say put that person on the team and get their ideas about why something wouldn't work and what else might work. But if your change leader has a hard time managing that person's negativity, then leave them off the team. And we can talk individually about that as the project gets going. So what the change project is, what you will do is you'll take the key problems that you identified for the application, and we'll work with your change team on learning the NIATX model, help them identify some possible causes of the problem, and then possible solutions to try. And then they will select a series of small changes to pilot test, and they'll work with the change leader and executive sponsor to implement those pilot tests that worked, that seemed to be effective. So you don't actually implement anything until you have a good sense that it works from a trial. Just these are some results. I know I need to finish up my time, so I'm running over here. These are some results that NIATX has had in a past project. They're pretty amazing results. Reduced waiting times. I mean, I've seen people go from 40 days to next day service. So through these sort of what seem like small changes, you can make really profound changes in your organization. So Alexa, I'm done.
Great. Thank you so much, Kim. And that hopefully provides a very helpful background, again, for those of you that this may be the first time that you're hearing about the NIATX model and the work that they have been doing really across the country for the last 10 or 15 years. Now we're going to switch gears a little bit, and what we want to do is spend a little bit of time walking through the application, really reviewing the goals of the project, support that the sites will receive, and then again reviewing the application and want to make sure we take any questions that you may have. Again, just want to remind you that in order to ask a question, please type your question into the Q&A panel. That should be on the bottom right-hand corner of your screen. And again, as we're walking through these, if questions pop up, please let us know. So the goals of the project have been touched on briefly by both Danica and Kim, but do just want to walk through again when we were conceiving this project. These are sort of the key things that we really see across the country in terms of what is happening and what's not happening in regards to work between treatment providers and corrections agencies. So the goals of the project are really to work in these partnerships to ensure that resources are being used as efficiently and effectively as possible. Really want to increase partnerships, in particular between corrections, community corrections agencies, and community treatment providers, because we know that's so critical to the success of individuals who have drug and alcohol problems when they're reentering the community. We want to, as was hit on earlier, improve community treatment referrals, the number of people who are participating in treatment, how long they're staying there, and really reduce treatment wait times and no-shows. Those are sort of the key aims of the NIATX project. We want to decrease the time that either corrections treatment providers may be spending trying to find services for people once they're released. Parole and probation officers, we know sometimes they have an important role in trying to help people find treatment. And so those are really some of the things that we're trying to improve through this project. And then finally, really minimize the amount of time that an individual is disconnected from care when we know they're at increased risk of relapse, potentially overdose, or committing an additional crime. So we've gotten a number of questions about the type of support that sites will receive. As you heard earlier, you will be getting technical assistance from both the Justice Center and NIATX. Each site will have their own coach from NIATX who will be the person that will be moving through your change project with you, convening those monthly calls, doing site visits. And then finally, we will have a number of experts that we'll be working with that have really done a tremendous amount of work looking at the issues that really impact access to substance use and co-occurring treatment services for people who are incarcerated and then those on community supervision. We've gotten a number of questions about whether any funding is available to support your work with this project, and unfortunately at this time, we do not have funding available to sort of pay for your time, so to speak. But I think we're hopeful that at the end of the day, the involvement in the project will really pay for itself. So what does being a pilot site involve? Again, a little bit of this is repetitive, but just want to walk through some of the a couple of clear things that we're hoping people sort of understand about what it means to really be a pilot site. As Kim mentioned earlier, really spending some time mapping your treatment referral and linkage process, understanding what the problems are, as well as what the strengths are. What do we do well and what do we not do so well? Using the results of that exercise to really discuss with your staff and identify a change project and form a change team. And then use, as Kim indicated earlier, the Plan, Do, Study, Act model of rapid cycle change, again, with support of your coach to make those improvements over an average of 9-month period, but as Kim said, make it through a number of different things in that time period. So application requirements. Hopefully you've all been able to download the application, which is available on the Reentry Resource Center website. The first first bullet here really emphasizes the really intent and desire of this project to be across agency collaboration. We really want for both the corrections or community corrections agency and the treatment agency to be co-applicants because we think both are very important to the success of this project. So that's one of the first things you'll see in your application is really a identification of those two agencies in particular. Some people may have more, but those core sort of treatment and corrections agencies that are going to be the lead co-applicants. As part of the application, you need to be able to describe your treatment, referral, and linkage process, and again, describe any current challenges. I think as Kim said, we're not looking for, perfect sites. So there are problems, and that's in part why we're doing this project. So really want people to be able to demonstrate sort of a real clear understanding for what's working and what's not in terms of their referral and linkage process between the corrections, community corrections agency or entity and the community treatment provider. Additional application requirements, identifying the change leader, who Kim talked a little bit about earlier and the things that are so important in that person's role, and then really identifying an issue that, at least at the outset, representatives from both agencies feel like it's going to be sort of what they're going to focus on. I think we all understand that may change or alter a little bit as you start to move through your project and your work, but really at the outset, want to have a sense from you in the application what you see initially as sort of a key problem, and hopefully that will result from the walkthrough or something similar to mapping that you're able to do in advance of submitting your application. So the site selection criteria, we'll walk through these, and then we'll have time to take some questions. History and strength of the collaboration and partnership between the applicant agencies. I think we do really want to see applications that have partners who have a history of working together and have been involved, or at least have a good working relationship. Again, already stated this, but we'll, again, re-emphasize that we're really looking for the site's ability to articulate the factors that are prohibiting, delaying treatment. Again, want you to be able to very clearly identify a key issue that both systems agree is an issue that you at least initially want to focus on for your project. As Kim mentioned, there is a small data collection component, so it's very important that you're able to give us some sense in the application for how long it's taking people to get into treatment right now, the number of people referred that can access treatment, some of those sorts of pieces of information. And then, again, as Kim said, a sort of core component of this project is ability to collect the data to sort of show that what you're doing is having an impact. And so that's something that is very important in the context of your application. And then the inclusion of top administrators from each participating agency, again, want to see sort of a demonstration that exists. Finally, two other things that I think we would like to see in the applications is, sort of a willingness or interest in sort of previous involvements to improve practice, including the use of evidence-based practices. But, just generally sort of what efforts has your agency, more agencies undertaken to really improve the way you're doing business. And then finally, of course, we'll be looking at, agency size, where people are located across the country, and then just a general history of innovations will all be considered. I will say that we're going to be posting on the website sort of with the application very soon a document that will provide you more information about the scoring criteria for the application. So that will give you a little bit additional guidance in terms of what we're looking for within each of these areas. So finally, a question that we've already gotten from a few interested sites is the anticipated time commitment. So as Kim mentioned, there will be monthly phone calls over that roughly 9-month period where you're deep in your change projects and talking to your NIATX coach and moving things along. We right now are planning for that change project to run from about April of this year through December, with maybe a month or two of wiggle room. There will be 3 site visits for each site, so that's something that you have to spend time thinking about prepping for and participating in, and any sort of debriefing. We will be convening a meeting in Washington, D.C. next year of the 3 sites and their change teams. Likely will be a 2-day meeting, so there will be a little bit of time involved with that. And then finally, sort of the time required to implement the change. The change leader is going to spend, probably a couple hours a week on this, and then the change team members as well, expected to also spend some amount of time on the project. So with that, those are some of the main questions that we have gotten so far. At this point, I think what we would like to do is to take some questions from people who are listening, and I see we already have a number lined up, so I am going to try and walk through these as quickly and as efficiently as I can. So this question, I'm not sure if we can answer or not, but I'm going to throw it out there and we can think through it. So the question is whether the corrections agency, can the corrections agency name the provider and contract with the provider without the provider being selected through a competitive solicitation based on state purchasing exemption rules? Kim, I don't know if you have any insight to that. I think it'll be different in every state, but I'm not sure.
So I would say if you're thinking about someone new that you've never worked with before, that wouldn't be appropriate. But for this project, from our perspective, it doesn't matter, like the whole state procurement process doesn't matter as long as you're working with them already and the services are being funded some way. I think because this isn't a state-funded project, and so I don't know if that gets at the point of the question. And maybe if we didn't get to the point, that's something you should follow up with us on.
Yes, please do. So the next few questions I think I can answer, but Kim, if you want to add anything, please do. A question about whether or not the project should target people who are on supervision or not on supervision following their release from prison. The answer to that is really either. So, I think we want a broad range of applications and scenarios because we know how many scenarios there are in terms of how people are released and supervised in different sort of criminal justice statuses, so to speak. So there is not any predetermined, idea that we're going to focus on people who are on probation or parole as opposed to people being released. So I wouldn't feel that you can't submit because you're working with one population versus the other. Another question about whether this is a model that would be applicable to a specialty court. And I know I'll say maybe just a sentence, and then Kim, you can follow up. The NIATX has done some pilot sites with drug courts. That is not really the purpose of this project. It really is to look not at court systems, but really at corrections, community corrections systems. There's certainly information on the NIATX website about some of the work in the drug courts. Kim, if you want to say anything else about that.
Yeah, probably nothing more than if you're thinking about a drug court project, we've been doing some work with SAMHSA-funded drug courts, and there is a whole section of the website that's devoted to that population. So go ahead and look at that, and feel free to contact me if you have questions about it. But that's not what this project is for. But there are other opportunities, so that would be something to look for.
Great. A question about community treatment and the definition. Is it just substance abuse or other types of treatment? We are referring to substance abuse or co-occurring substance abuse and mental health treatment. So focused on sort of people with behavioral health disorders. Can we work with therapeutic communities in prisons? Yes, you can. A question that was asked online, but I'll answer it publicly. How many sites are going to be involved? We are going to pick 3 sites for the project. Good question. Is this opportunity designed more to target large state systems or community-specific projects? Kim, did you want to?
Yeah, I'm trying to envision how we would do this at the state level. That's not how we designed it. We designed it for more community-level projects. And I saw one other question about executive sponsor being like a state department head, and that wasn't what was in my mind when we were designing this project. I think we're really looking at the community level, the direct service level partners.
Sorry, just scrolling through. A question about whether we are requiring you to partner with only one treatment provider. This is, I think, something that's come up. As Kim was just saying, I think initially that's what we were thinking, but again, understand that there are, sort of a range of different scenarios under which people are, referred to treatment. And so I think that, at this point, no, the answer is no. We're not sort of requiring you to work with just one provider, but, I think you want to have sort of a core group of providers that you have been working with your referring, and I think also given what Kim had said about the size of the group, so thinking through if there's a way to maybe identify, a couple of key providers that you may want to focus on initially with the intention that, depending on how things go, you could broaden out some of the processes. Kim, does that make sense to you or anything you would want to add?
Yeah, no, I think that really says that you want to think about who you work really well with and who would be willing to try new things with you. And if you have several organizations that you think that applies to, I think we can work with that. We're always going to push you to pilot test on a really small scale. So that's just, that's part of how we're going to try and get you to think about how to start to solve problems, but ultimately you want to bring them to scale with as much of your referral network as you can use. So I would definitely encourage you if you have a lot of partners and you think that there's a way to do that, let's look at it and we'll figure out how to pilot test things on a small scale in multiple places or something.
Okay, great, thank you. Kim, do you want to talk a little bit about one of the questions that came through was, what's the expectation of cross-agency collaborative work with agencies that are broader than sort of mental health, substance abuse, and that also may play a role in successful reentry? I think that's the question.
Well, I guess, and Alexa, if you disagree. You get to decide. But I think my reaction to that is if it's an organization that provides multiple kinds of services, including behavioral health, I would say go ahead and partner with them. But that behavioral health is what we're looking for.
Right.
So to make sure that that's part of what they do.
Yeah, absolutely. And then, and I guess another question that we sort of have touched on and touches on sort of our intention and then sort of what sort of interest we're getting from different partners. And it's, would this project be appropriate for a state-level substance abuse and state-level corrections department? Because I know you've done some work on the state level with, state behavioral health agencies, and does it make sense for people to think about this project in that way?
Well, I would love to do that project. I don't know if it's this project, though. Do you know? I think, I would love to work with those two, with whoever that is. I think that would be a really good thing to do. I just don't know if that really fits our aim here. And maybe that's something you have to answer, or that's maybe even goes back to BJA. I mean, I think what we were trying to do here was look at community services, and when you're looking at the state departments, you're really looking at different processes. So my inclination would be to say no, but boy, that would be a good project to do.
Mm-hmm. So maybe stay tuned on that.
Yeah.
I think we could kick it around a little bit more, and does it make sense for that to be sort of one of the sites we want to take on?
Right.
So I would, encourage whoever asked that question, please, this is Alexa Eggleston, please follow up with me. My email is on the screen right now, and I think what we can even do is maybe we'll include that in the frequently asked questions document as well that we'll be developing that will offer some additional guidance. Okay, so a question about the walkthrough and whether it should happen prior to the application or as a result of the project.
So both. I think it's a really good thing to do prior. It will really strengthen your application to do that prior to the application, because you're going to get a really different sense of what the issues are than just looking at data or just talking to staff. So if there's a way to do it before you send in your application, I would recommend doing that, and I'm happy to answer any questions about, because I know I barely skimmed the description of that, so I'm happy to answer any questions you have about that process. But it's something that we'll also do if you haven't done it and you wind up in this project. We'll do it again. It's one of those things that it's good to do over and over. So I would say both, but really, it will really strengthen your application to do it before.
So there's a question about whether there's a research component to this study, and does it help if the agency already has some sort of relationship with a researcher? Kim, do you want to talk a little bit more about sort of the data and the bit of evaluation you do with that data that you collect?
Yeah, I mean, my short answer is no. You don't really, I mean, the kind of data that we're looking at is back of the envelope data to make quick decisions on. I mean, what we're going to do with this when we're done, I mean, for us, this is a pilot project, and we hope to learn from the pilots and create a document that will be helpful to people, but it's not really a research project. So I actually, in some ways, working with researchers, and I am one, so I say this with love, working with researchers for this particular kind of project actually might make it more complicated than you want it to be.
So we've got a couple of questions about sort of the types of collaboration that we're looking for, or sort of scenarios. So let me try and pick a question that does a good job of summarizing. I think generally a number of questions about trying to work with multiple providers, whether it's across a rural site or just generally the dynamics of all the different people that are sometimes brought into the reentry scenario. So I guess I'm just sort of wondering, the question is really, what is that a scenario that would work? I guess I'm going to ask Kim, sort of you to comment again, sort of in your prior experience, have you worked with places where they've had sort of multiple treatment agencies on one end that people are trying to get referred to, or is that something that makes sense?
I think it does, and so how can I make this short? I think it does. I think a lot of what you're looking at is going to wind up being your own internal processes and how to make those function better, and you can do that, and that will help everybody, so all of the partners. And then what becomes complicated, but I think it's doable, is if you have multiple partners and in trying to pilot test how things, they're all going to have different processes on their side, and so how you figure out how to pilot test something that's cross agencies, it's a little bit more complicated, but I definitely think if politically you need to do that, to go ahead and do it, and we can make it work.
Okay, great. So a few questions that I can answer. Kim can take a breather. So a question about financial assistance for this project, and unfortunately, no, at this point we are not able to offer financial assistance for people to participate. A question about, but there will be funding. There was another question about funding to DC. There will be funding included for that travel for the team, the core team members to DC. The project does not have to start in incarceration. It could be either jail, prison, or a probation, a community supervision agency could be the partnering agency. A question about whether there's any particular target population in mind. That answer is no, right, Kim?
Right.
Okay.
Although, did you say it's adults?
Yes.
Did we decide on that? But other than that, no.
No specific. You should not be expected to say you're going to be targeting, this many people, which is sometimes a request in other grants. And just to clarify back on sort of the funding and the benefit, yes, the benefit does exist in the TA that you will get, and just being involved in the change project. At the end of the day, should be improving your business practices, and the slide that Kim put up in terms of getting more people into treatment, keeping them there. Those things are really tangible results.
Melissa, can I just add, most of the organizations that we've worked with at the end of these projects, they've either had huge cost savings, or for the organizations that earn revenue that aren't just totally grant funded or aren't publicly funded, they get more revenue. So there's usually a benefit to the bottom line, and that is part of the reason that it makes sense to do it. So there are time costs for your staff, but in the end, it really should wind up actually saving you money or earning you more money.
A question about if the state prison wants to pilot with a treatment provider for the releasees, is that okay? Yes. I think, as Kim was saying earlier, that was initially what we were thinking about in terms of what the partnerships would look like for a state prison. Would be sort of one that had a place, a specific provider or community that they were referring people back to. Maybe it's your community, one of your communities where the local people are returning, as we know is often the case for those people involved in the criminal justice system. Sort of similarly, can the state prison look at their in-house treatment programs and is the mentally ill, chemically addicted? I think that's what a population, what you're looking for primarily. Yes, the state prison, I think part of what would be great to sort of look at in particular is for those prisons that do have treatment happening behind the walls. We know how important continuing care, aftercare is in the community for outcomes, and so I think that would be a really interesting site or proposal to put forth. In regards to whether we're specifically looking or primarily looking for a co-occurring population, I would say no. You feel free to focus on, I think substance abuse, but, given the rates of co-occurring substance abuse and mental health disorders in, the incarcerated population, it's, a lot of your folks are going to be, have some, type of co-occurring substance abuse, mental health problem that they are dealing with. And I know we've had a number of questions about this, but, I just, again, want to reiterate a question about, are you saying, generally speaking, this is a better project for smaller community agencies, mental health and substance abuse with county jails? I'll sort of start, and again, Kim, given sort of your work on this, I would say not better. I think more than anything, whether it's a county level, is having sort of either a single treatment referral point or maybe just a few. I think that if you are coming at this as the Department of Corrections and you are, there's 10 different, treatment providers that you refer to across the state, and as Kim was sort of saying earlier, I'm not sure that sort of this project is yet at that place. So I don't want to discourage, Departments of Corrections from applying, but I think if you have a particular area, again, in mind, that may be the way to go about it.
Yeah, I think, when I think about, Departments of Correction or Departments of Health or Behavioral Health or Substance Abuse state agencies, I'm thinking of that particular organization. But if you have a facility, if you have, like in some states, you have one state prison. If you have a facility that you're thinking about, I think that then the department is the right applicant. What I was trying to say before is that when you're thinking about sort of the state systems and how the state system functions, that's a really great project, but I don't think it's a great project for this application. It's not how we really designed it. But a facility working with providers, if it's a state facility, and it can be large, I don't think the size of the number of offenders or the number of referrals can be huge. That's not really the issue that I was trying to get at in terms of thinking about state level systems. So I hope that's clear.
And I think we have one final question we can squeeze in, and this may go into some of the drug court work that you're doing, but a question about whether there are any institutions that have already used this particular model.
Yeah, so as I think it was Danica that said earlier, when we think about corrections departments and corrections institutions or community corrections, there isn't a history of that, but we've done a lot of work in child welfare. We've done probably, maybe 100 sites in drug court now. So there's a lot of history of work that's in similar kinds of structures, but this really is a pilot. It's the first project in corrections itself, as far as I know.
Great. Thank you. And with that, we're coming up on the hour, and I think I got through all the questions. But again, if I did not, please feel free to email either myself or Kim at the emails that are listed there. I just really do want to encourage people to reach out, ask us questions. We really are looking for innovative ideas and ideas that are, sort of outside the box. So if you have a question about a certain scenario or arrangement, please feel free to reach out to us, and we can help sort of think through whether or not it makes sense or not for you to go ahead and apply. But I think as we've all sort of referenced, this is sort of uncharted territory in some ways, although it's a model that's been used across a number of different systems. We're all sort of in this together, so to speak. So, again, please feel free to reach out, and, again, just encourage you to apply. We're really looking forward to some really strong and rich applications. And with that, I want to thank everyone for attending and participating. And, of course, thank you to Danica and Bureau of Justice Assistance for sponsoring the webinar. And thank you to Kim Johnson at NIATX for being on the presentation with us today. Again, a recording of the presentation and slides will be available online at www.nationalreentryresourcecenter.org. And this will conclude our webinar. Thank you very much.